This brings us to the second panel discussion on building strategies to manage care, delivery, and optimize digital health capability. I'd like to introduce our eminent members, starting with our respected moderator, which is Ms. Professor Michael J. Miller, member of the Digital Health Technical Advisory Group, roster of experts, World Health Organization. Then we have our panelists, which is Mishal Al-swidan, Health Information Management Leader and Healthcare Management, Project Management and Healthcare Innovation, Security Forces Hospital, Kingdom of Saudi Arabia. Hani Baraqaan, Chief Anesthesia Technology Services and Co-Chairman of Anesthesia Innovation and Digital Transformation, Ministry of National Guard Health Affairs. Mubarak Al Shardan, Business Leader, Healthcare Informatics, Philips Middle East, Turkey and Africa. Safa Al-Mashtoub, Director of Strategy and Governance, Digital Healthcare of Excellency, Minister of Health, Kingdom of Saudi Arabia. Mr. Fahad Al-Sali, Planning and Improvement Leader in Immunizing Operating Center, Ministry of Health, Saudi Arabia. Over to you, Professor Michael, to moderate this wonderful panel.
Well, firstly, may I begin by thanking the KSA sponsors and the audience for inviting us to the panel today, and may I welcome all those that are part of our panel. Let me begin by sort of looking at the area we are supposed to discuss today, and that is enriching the continuum of care, care and healthcare standards with digitally enabled care. So to begin, I would like to make the following statement. Healthcare systems around the globe are challenged by increasing demand and demographic change in population. The fiscal sustainability of healthcare provision worldwide is in question. Chronic conditions, non-communicable diseases, now account for the largest element of healthcare expenditure worldwide. The need for an integrated care, a more efficient and effective integrated e-health system capable of delivering a single unified patient summary care record has never been greater. It has been over half a century since the paper widely accepted as the genesis of the electronic medical record, a paper entitled Medical Records That Guide and Teach by Dr. Larry Weed and published in the New England Journal of Medicine in March 1968. However, to date, no nation has yet delivered a single unified patient record. Patient data is siloed in individual systems, and common standards to facilitate semantic interoperability remain incomplete. However, in recent months, there has appeared 3 initiatives that might address or begin to address this significant problem. They are: 1, the proposal for regulation of the European Parliament and of the Council of the European Health Data Space. Number 2, the intervention of Larry Ellison from Oracle with his acquisition of Cerner, where Oracle thinks it can fix healthcare's biggest technical issue, as Ellison describes it, outlined with trodden problems in the US health data system. Patient information is siloed, often within individual institutions. And the third initiative is the world's first cross-border digital health framework program that includes Sweden, Denmark, Norway, Finland, and Iceland. So as I ask each panelist some questions going forward on their views, if time permits, I would like to ask some general questions of the panel. They are: what is the single biggest challenge you face when enriching the continuum of care and healthcare standards with digitally enabled care? And number 2, how are you addressing the challenges of semantic interoperability, which a number of leading thinkers in the domain believe to be the greatest challenge in e-health? But let's begin with our first panelist, Mr. Fahad Al-Sali, and his first question. Can you please tell us the top strategies to manage care delivery in the Kingdom of Saudi Arabia? Over to you, Fahad.
Thank you, Michael. Hello, everyone. This is a question when you thought it's to concentrate the strategy in healthcare delivery. It's sophisticated and sensitive, you know, because it's patient-centered and hard to achieve to complete satisfaction. But Saudi Arabia constructed the healthcare transformation plan in two main pillars. These pillars come from its national transformation program. Its first one is improve the health service, and the second one is enhance the quality of life. These pillars, the transformation, the healthcare transformation program aligned with this pillar, and we cascaded to a strategic or objective in our strategic. It's we implications is 4 objectives. It's first of all it's a better health, and that is public health improvement, and some initiative of that, raising average life expectancy in the kingdom from 75 to 80 years, and health in all policy. Second one is better care. It's improving the beneficiary healthcare service by enabling the beneficiaries to access the healthcare service, while enacting the digital revolutions in the field of healthcare. Third one is a better sustainability. This controlling it's the healthcare cost by implementation of the modern model of care in Saudi Arabia that will reduce the cost burden in the healthcare budget. Fourth one is a better workforce. We choose this for is a better health and better care and better sustainability and better workforce based on when we met various challenges in our country. It's like assessment, and we did assessment in our country, and we met the various challenges of public health. That's the average age of an individual, and challenges to effective delivery of quality of healthcare. Third one is the challenges to financial sustainability of healthcare. The cost of healthcare right now is increasing a faster rate, rate than the increase the national income. Fourth one, the challenges the workforce size. We met some obstacles, some challenges for attracting and retaining the doctors, nurses, and other skills healthcare. As I mentioned before, it's when we start to begin to do strategy, it is some sophisticated. But we did this assessment, and we get these challenges that why we set these objectives.
Thank you. I have a second question I'd like you to answer, if you would. And that is how to optimize digital health capability for the Saudi Arabian healthcare industry.
Great. As you know, as the digital in Saudi Arabia is takes the focus from all the sectors, not the healthcare specifically. You know, is the in the 2021, it's Saudi Arabia spent 4.2 billion to develop the digital content, and spent 4 billion to enhance a capacity digital. This for all the sector, and we get this link to enhance the and optimize the digital health in our sectors. as I mentioned, Dr. Hani Radadi about the SAHA virtual, that it's a great initiative, and now it's I think reached to mature and expanded to most of region in Saudi Arabia. It's a SAHA hospital. It's a great virtual interaction among citizens, and we cascade this SAHA hospital to small application that people we will benefit of that. And we also can the workflow automation and all health sectors the policy and the procedures, all procedures in the Ministry of Health. We start to not start. We reach to good to automation all process. And that's it. Over to you, Michael.
Shukran, Mr. Farhad, and thank you very much for the insight you've afforded us.
Yeah, welcome, Michael.
Thank you very much. Perhaps now it's time to move on to our second panelist. I normally would have gone ladies first, but I understand that Farhad may have some time constraints. So I would ask Ms. Safa if she would address the following question. The Saudi Kingdom is now embarking on the rollout of its completely redesigned system in line with the strategic objectives of Vision 2030. We would like to learn more about the major strategic shifts in the context of virtual care. Over to you, Safa.
Thank you very much. And actually, it is with honor to be here today with you, Michael, and with the thoughtful panelists here discussing strategic direction in the context of digital health, which is a very prominent and very, very important topic. As you mentioned, Saudi Kingdom is now embarking on the rollout of its completely redesigned healthcare system in line with the strategic objectives of Vision 2030 and performance indicators built on the fundamental pillars of a joint commitment of public, private, and third sectors that will work to realize these objectives as mandated by the Council of Economic and Development Affairs and under the leadership of His Royal Highness Crown Prince Mohammed bin Salman. This national strategy basically is translated into multiple delivery plans designed to achieve its strategic objectives through innovative practices aligned with national objectives following a specified timeline towards successful completion. So the objective of this phase basically is to outline an operational plan that will achieve an enhanced level of health and beneficiary services, contributing to a prosperous and sustainable future. So virtual care now, in line with the Saudi vision, the envisioned transformed health system aims to facilitate citizens' access to free health care and insurance. And this can be accomplished by fair, comprehensive geographical coverage across all regions at the kingdom, as you mentioned in your introduction, Michael, enacting digital revolution in the field of healthcare with e-health and virtual care as the core, making it easier for beneficiaries to access services. So therefore, I would just go a little bit back to during the pandemic time, of course, the acceleration of the expansion and adoption of digital health across different regions was basically adopted by the Ministry of Health at that time, making sure that the platform is actually activated in 80% of regions in the kingdom, making like up to 2 million consultations from nearly 13,000 subscribed practitioners to this telemedicine platform. At this pandemic time, making it let's say easier to accelerate probably the implementation process in the context of digital health. Secondly, an innovative model of care was born out of necessity at that time, which is SAHA Virtual Hospital. And I think our colleagues mentioned to it several times. This model basically was built during that time where we all came together with leadership, putting together and designing and strategizing for this model to make sure that we are offering several services or different type of services, whether it's specialized care, critical care, and making sure that we are, as much as we can, connecting with the other providers in areas across the kingdom where they can benefit from those services using technologies. So if we want to go back to our strategic direction in that sense, I would say that the evolving and the expansion and the rollout of digital health now in the kingdom is basically prominent and is evolving, and it's going fast. Supporting the global sustainable development goals, trying as much as we can to transfer knowledge and experiences also to other countries in the region and internationally. And it's more of a exchanging knowledge, and this is happening through our strategic collaboration with, for instance, WHO and other international entities, where we basically be an active members who can share lessons learned, experiences, what happened so far, and basically enable other systems across the globe to benefit from the design and model so far, and also to learn from others to invest more in capability buildings and knowledge sharing and to improve and enhance the system. Definitely contributing to capacity and capability building is major in this aspect. And this happens through even trying to emphasize more on cross-border practice, trying to emphasize more on investment on local and international technologies that will, and emerging technologies that will definitely enable healthcare and the systems and ensure better outcomes and increase access to care. Also, we are definitely supporting investment in that piece, and we promote research and innovation in the area of digital health. So our strategies are mainly, and streams are mainly focusing on those pillars, like focusing on how to roll out different services in line with the top priorities when it comes to population health needs. Also support emerging technologies, local and international. Support investors, local and international, with the purpose in mind to basically enable healthcare to meet the population health needs. Definitely promote research and innovation, activate programs in that aspect or under that umbrella, and transfer knowledge and invest in capability building. I think definitely building strategic bridges with other countries to exchange knowledge and activate knowledge, and even position the kingdom across the globe as we believe that we've progressed a lot in this area so far, and we are happy to share what we learned and learn from others. So without further ado, I'll hand it to you. Thank you so much, Michael.
Thank you, and a very interesting presentation there. Are you using 5G or developing 5G in your virtual health domain within Saudi Arabia? Is a question that comes to mind.
Are we using what? I'm sorry? 5G telecommunications, 5th generation. Yeah. Yes, I think it is in collaboration with the Ministry of Communication to basically enhance and really build that capability even further, and make sure that as much as we can, also we reach to those areas in suburb locations where so we can enable them to benefit from virtual services that we're providing. So yeah. it is a work in progress, and I think the strategy is quite optimistic and ambitious to reach towards that level.
Now, God bless you with your program, and I hope that it all goes very well, and we wish you the best in rolling out that very much system. Thank you.
Thank you, Michael. Thank you so much. Appreciate it. Thank you.
God bless you. And I'd like to move on to our third panelist, if I may. Mr. Mubarak Al Shardan. Good hello, welcome. I'm frightened to say good morning because I'm not sure what time zone our viewers are always in. So may I ask you the following couple of questions? So let's start with how TAGI solution adopted in KSA, looking at different hospitals, different HIS systems, different locations, maybe cultures and different stakeholders is working.
Thank you, Michael. And it is, yes, it's a morning. It's 11:47 here in Saudi. I'm based in Riyadh, and it's a very interesting question about TAGI, how it's adopted. I was mentioning it in the slide as one of the use cases of the telehealth concept that adopted in the Sahha virtual hospital. So I'll go a little bit from the beginning, where the addressing the pain of the hospital is that everything done in a traditional way, everything done in the cardiology department in a paper manner. So everything is printed, everything is handwritten. Anything that related for the ECG, for the stress test, for the echo, everything, it will be done into papers. So the first thing is they want to digitalize, but also because of the need, they don't want to digitalize one hospital. They wanted to digitalize multiple hospitals, a group that at certain level of pain, and they are willing to change. So it started from Ministry of Health by creating a committee of telecardiology network. They have a cardiologist from each one of those radiologists. Everyone input what do they need or how they envisioning the future of the digital cardiac solution, and then they wrote the RFP. And I believe this is the starting point by involving the stakeholder, not bringing them a solution and asking them to adapt with it. And this is one of the main concepts in the change management, which was applied early beginning in the project. Moving forward, after the awarding of the project, we started in doing more detailed assessment for the sites, because the time of the RFP written till the awarding to the delivery, a lot of technology evolved, and also the demand a little bit changed. So we were closer with them in understanding their needs, addressing them exactly what they are looking forward. And also we built a virtual lab for the solution that will be upcoming in the next 6 months. So everybody will have a view through a window of the future that they can see exactly what is happening. Going further with the implementation, everything was smooth. Technology is easy to be implemented with the good infrastructure that we are having in Saudi, especially Ministry of Health. But the challenges was about the legacy systems. When you talk about HIS systems, some of them are not supporting the international languages. So how we can adopt that? So we work together with our partner in developing certain engines to at least capture the needed information and process them in our solution and make the entire workflow is identical. We didn't want to have multiple solutions, multiple workflows, registry through manual registration or through HIS. That will confuse everyone. And building the network by one workflow, we didn't actually think about it in the future about the pandemic. It was 2018. We didn't even think that there will be a pandemic. But during the event of, or during the pandemic, we saw the value of that. And that's the good thing about having a good resource, that they can capture any solution, they can reuse it for other services. So the network, with the challenges of the travel between cities during the lockdown, it allowed the cardiologists to see their patients through a distance. And that's one of the first use cases in TAGI. Furthermore, we noticed that a lot of patients, they cannot travel, or the demand increased to use the solution. So Ministry of Health formed the committee of the national cardiac diseases. And this committee are having a place, I think, with the Mustafa in the same floor. They are working that they can go together, meet, review all the cases. And recently, what is the best thing that I really like to hear is the voice of the customer or the patient. And I saw a video last week from a patient thanking Ministry of Health for supporting his case. Instead of traveling for 2 hours flight, which is in his case was a patient, it was very difficult for him. But using the technology, the entire cardiologist sit together, agree on certain treatment, supported the cardiologist in that region to provide him the right treatment, and he's well, in a good health, and he recorded that video. So the entire concept of the adoption, it's related to the experience of the people that they know how to implement, partner readiness, the involvement of different stakeholders, and of course, layered by change management and support of top stakeholders in the organization.
That must have been a huge challenge that you've undertaken, and I'm pleased to hear that progress is being made for those that are in any location within your country. So I'd like, if I may, ask you a second question. Aside from patient-doctor consultations, what are other use cases for virtual telehealth concepts that could be considered in healthcare?
Sure. So if we go with the telehealth originally, maybe one of the main components were about doctor to doctor, which is radiologist to radiologist or radiologist through a distance. And that was the initial concept of telehealth. People used to radiologist or provide second opinion through a distance. But with the pandemic, the telehealth, when it comes to the public, everybody were thinking about how to serve the patient at home, and that's where started with the virtual consultation solution. And we are happy that the platform is powered by Philips in Saudi Arabia of virtual consultation together with our partner Lean. And having this, but it is not the limit. This is not what we are looking for. There are a lot can be utilized, especially with your question about 5G, can be utilized with the telehealth. So I believe doctor to doctor is also an important thing. Consultation between physicians is also important as the home care patients. We are seeing a lot of solutions, innovations that can capture the information from the patient while he's sleeping before goes to the hospital. And this is where exactly we really need to capture this data. This data will support, first of all, building the knowledge, the understanding of the patient after the appointment or between appointments. So which will eliminate a lot of patient doctor's time and also provide a faster treatment for the patient. But also this is not the thing that with the patient. I'm thinking about what are thinking about doctors. So if you take, for example, the oncology informatics. So it is a tumor board. It is a huge consortium or consultants sitting together, agreeing on a case. How they are doing it today? They are doing it in a meeting room, taking it, consulting one case and decided on it. But if they are not together, the paper will be traveling or a phone call will be there. But how can we make it in a platform? So that's where we are looking at it, a platform that having all the inputs from the radiology, from the laboratory, and also from the oncologist, that they look at it together and then decide on it. And also continue that with the treatment plan. So you can also, whatever you have captured together, you can take it through the journey of the patient's treatment. And that's everything. We believe that anything that can be done in face-to-face engagement, and it consumes a lot of time by waiting for physicians to be there, it could be replicated if addressed well through the technology. And we really need to pass by the concept of virtual consultation for the patient. It is there. It will be a traditional way of triaging and follow-up meetings. But what about the other cases that we really need to have fast response? I hope that answered your questions, Michael. I'm sorry for taking long.
No. It's been, sorry, it's just a time constraint. I'm very interested in what you say, and I wish you luck with your 5G because you get increased bandwidth, minimization of latency, and the volume of data you can assemble and use AI and all sorts to monitor patients and generate intelligent-based alerts is surely the way forward. And I think it's really impressive the work that's being done in the Kingdom of Saudi Arabia, and I genuinely wish you all well on that.
Thank you very much.
Mubarak. God bless you. And I move on to our next panelist, Forgive me, I'm struggling a bit with my health at the moment, temporarily I hope, so I'm not at my best. Mr. Mishal Al-swidan, welcome. I would like to ask a couple of questions, if I may, and I would like to begin with, how can the organisation achieve the strategy while there are lots of changes on day-to-day change requests?
Thank you, Professor Michael. I am very happy to be with you today. So regarding your question, many organizations face challenges in strategy implementation due to gaps in strategy, such as lack of governance and required discipline. Change is sometimes unavoidable and maybe necessary in other times. However, to succeed in strategy implementation, a multifaceted solution uh, pertains hiring the right key leaders and having rigid frameworks in place. A proper communication of the strategy, goals, vision, and mission statements across the establishment is essential. It is key to have all staff on border aware and aligned of the strategy. Change can be minimized by determining roles, responsibilities, RACI metrics, and teams assignment to guarantee gaps are bridged and change is conducted by the right people using the right framework.
Thank you very much.
I think
Sorry, go on, Karen.
maybe
Yeah.
yeah,
Yeah, please continue. Sorry.
it's enough. Thank you.
Oh, okay. Sorry. I just want to. Okay, so that's very good. So can I ask the second question then? What are the main resources and specialties needed in the healthcare IT domain that you believe are necessary?
Skilled healthcare IT resources are key in translating healthcare services and transformation into practice. Research selection needs solid criteria to ensure necessary skills are covered. Healthcare industry support treating patients in a continuum of services from curative, preventive, rehabilitative, until palliative care. Therefore, resources need to show deep understanding of how interdisciplinary teams and services work in harmony to provide the optimum healthcare services. Healthcare informatics framework consists of health science, social science, information science, and technology. Management skills would form the base across this domain's resource. Selection needs to address hiring experts across these domains to ensure proper integration of healthcare and IT.
Okay. Well, thank you very much for your insight today. It's been very, very interesting, and I'm sure you're playing a key role in the development of your nation's.
Thank you, Professor Michael. Thank you.
God bless you. And now, last but by no means least, Mr. Hani Baraqaan, if I pronounced that correctly, forgive my ignorance. You know what the English are like. We're not very good at anybody else's names or languages. But we do drink lots of tea. So may I ask you, A couple of questions, and I'd like to begin with why technology adoption and implementation do you think remains challenging? Over to you, Hani.
Thank you very much, Prof. Michael. I hope you get well very soon. My name is Hani Baraqaan, so it's even in Arabic it's hard to pronounce. So it's 2 minutes after 12, so I'll say good afternoon in my time. And your question is really a key question. So since the speculation lately has been shifted from acquiring technology or adopting technology to implementing and adapting these technologies. An article published by Digital Medicine Journal titled Beyond Implementation, and it's actually studying why implementation fails or remains challenging. It concluded that it's due to the insufficient attention between the relationship between technology innovation and the service innovation it requires. This is not new. McKinsey has an article titled Technology Alone is Not Enough. There is a survey done by MIT, and it surveyed 4,800 executives in 129 countries, in 27 industries, and the finding is the same. Technology is the least critical factor in this. So to go back to what we said, it's insufficient attention between the relationship between technology innovation and service innovation. To simplify this, we are healthcare providers. Healthcare providers provide healthcare. They don't provide technology. Hence, we provide a service that happens to be technology enabled.
Exactly.
Right? So the shift should be, the perspective should be shifting from acquiring technology to actually configuring a service that's evolving because of this technology. That comes from a human-centric approach, design thinking, service design. You involve and include and speak with those who do the business, the healthcare providers who have intimate relationship with their businesses and with their processes, and together with a technology provider, they should innovate a service that flows easily with this technology. A physician, I've been a health worker for 18 years, and I've seen this firsthand. When a technology comes and it's new, and it adds a cognitive load to the healthcare provider. So like, instead of making my life easier and the patient life easier, it's shifting my attention to 20 minutes of filling informations. This has gone now. Now technology should come with innovation that takes in hand the healthcare workers they are working with.
I think that's extremely insightful, if I might say. The challenge is, in my own experience in this domain, is that it's a clinical issue, a clinical problem. It's not a technology problem. And as you said quite insightfully, technology is an enabler. It is not the solution. Yeah. Please carry on. So I had to support you on that because it's so fundamental to success.
Yes. Yeah, you know, I concluded the answer, and you put it very nicely as well.
Thank you. So on to the second question then, if I may. What are the core outcomes of healthcare digital transformation, in your view?
Excellent. So different outcomes comes from different strategies and different understanding of the word digital transformation. There is a lot of speculations and, let's say, like a lot of definitions to what's digitalizing, what's digital transformations, what's transformation, and what's change. Dr. Rob Lilwin has a very nice saying. He says, when a snake changes its skin, it changes. When a caterpillar becomes a butterfly, it transforms. So there is different outcomes depending on what would you define digital transformation. But Lux Research put very beautifully a framework of outcomes that, regardless of what definition you have, if you digitalize or digitally transforms the organization, you should have values in one of 6 areas. So one of the first and easiest area, of course, it's automation. So you eliminate or reduce the human factors in the process. So that's already done in most since the last 2 generations. Then making information accessible to the right people at the right time in the right way. A lot of people, I like also this definition of digital transformation. It's the seamless flow of data between departments and with all parties. So this is what making information accessible. Making information accessible with the add of some analysis and data science will uncover invisible insight. These insights are not absorbed by the human eyes. It needs some calculation. It needs some data science approach to find a correlation or causation to something. This is, of course, only happens if we have the right infrastructure in what we said, like information is there and it flows easily. From this, we can predict the future. And actually, nowadays, just lately, we have a machine with an AI-enabled program, and it will predict a hypotension event 5 minutes before it happens. This is very futuristic for me. This is science fiction, and it actually happens. Optimizing is one of the outcomes, and it follows suits after automation. So if you automate a process and then you have enough insight and data about it, you put it in a constraint and you can optimize the service as you please. Last but not least, I would say upskilling the humans. So all these features are bringing new skills. In the inventor revolutions, when we started to use the mechanics and electricity, a lot of people would say a lot of hand workers will lose their work. They didn't lose their work. They upskill it to operate the machine. Instead of cutting themselves, now they're operating the machine that cuts. Now we need another kind of skills, another kind of work titles and of work people that they will operate these digital achievements. And that's it from me, Dr. Prof.
Well, thank you. It's been an excellent presentation and an answer to the questions. And I had the fortune to work over in Saudi at the Ministry of Health in Riyadh some years ago, and work with Dr. Hani Baraqaan, a fantastic gentleman, a pleasure to work with. And I think the team that I've seen today and the work that you're doing, you're in an excellent place to be able to influence, improve healthcare for your peoples, and hopefully within the region, so that your people can all benefit. Those perhaps who struggle in certain parts of the Middle East, who don't have access to the healthcare that might be provided, should be provided. I wish you all the best, and I thank you very much for your efforts, and God bless you all.
Professor Michael, sorry, there is a question that has dropped.
Yeah, I'm just come on to that.
Yeah.
Okay, because I realise I'm not going to get much chance to answer my questions, so maybe on another event I could ask those questions, because semantic interoperability, I think, is a major challenge. So the question that's been asked is, and I put this to the team, I don't know who wishes to answer this. Do you think that shifting the ownership of medical records to patients themselves could be a key factor in the process of interoperability and cross-border medical data integration? And are there any plans for such? Who'd like to go first?
Maybe I answer this.
Yeah, please.
Yeah, or I'll answer part of it, because from technology perspective, that will ease a lot of things. Of course, not adding ownership, but also being part of the data collective. So everything now in the healthcare cycle or continuum is measured and read by practitioners. But there are a lot of data that clinically validated. There are a lot of solutions that can capture information from the patient and provide it to the physician. But what we are seeing now in the cycle or with the physicians, that everything will be repeated again, because they really want to make sure to be assured that the reliability on them that has been captured 100% in terms of decision making on the data that has been captured. So even with the large equipment in Saudi, if there is a procedure done for MRI machine, for MRI case in one hospital, and for any reason the patient transferred to another hospital, in majority of cases they will be repeating that MRI procedure. Of course, that it adds a lot of cost, a lot of load on the organization. But if it is coming on the CT, it will add a lot of also radiation, which is harmful for the patient. However, still, it is important to be there. But I don't see that there is any regulations done in Ministry of Health, and I'm looking at Ms. Safa and also Saudi Health Council, if there is something regulated for that part. From technology part, I'm seeing globally that there is the health passport, where the patient can capture all of the information, and whenever he goes to the doctor, he just transfer that to the solution. And from interoperability platform, in our we made that ready. So whenever there is any concept has been done in the region, we will be able to deploy it. I don't know, Mr. If you want to add anything.
Yeah. Thank you very much. I would probably emphasize more on how important it is basically for population to be owners of their data measures and so on. And this is definitely in line with the Saudi Vision 2030 in the area of healthcare, because we're basically aiming for empowering population to be aware of their health, and we're seeking for better preventive care. We don't want sick people to come over to hospitals and facilities, but rather we want healthy people who can continuously check and be aware and understand their health status and well-being status. Empowering population with, so currently we can see it, basically when we look at for example, the telemonitoring or hospital at home and so on and so forth, all these technologies to some extent are some sort of involving population in the area of understanding their measures and vitals and being part of this. Again, from a regulatory point of view, as a chair of the national committee that's currently working on updating the regulations in the context of telemedicine and telehealth practice in general, I believe the experts are basically highlighting these areas to put the proper regulations that will empower population being involved in understanding and accessing their own data, and how can we basically utilize this concept to enable and to support our achievements to our goals in building or enforcing for better and prosperous communities with better health and so on. So again, I am, to cut it short, I am personally, I'm supporting involvement of populations, understanding and owning their data. We need more emphasis on enacting regulations to support that, making sure that we are not harming the patients by doing any kind of breach to their confidentialities or security aspects of it, but rather supporting them in being owners and responsible for and accountable for their own health, if that makes sense.
Yeah, I think it does, and I have to unfortunately summarise now. I would have liked to have heard more from you, from the panel. It's been an excellent panel, by the way. So I'm pleased to say I think there's excellent progress being made in Saudi Arabia for your healthcare systems, and I'm pleased to see such a comprehensive and wide programme with such capable, intelligent and committed people such as the panel today, to deliver that much needed healthcare improvement that's not just required in Saudi Arabia, but throughout the world. And hopefully we will be pleased to see Saudi playing a bigger role in the global healthcare sector. So that's the end of me. I've not been able to ask my questions on semantic interoperability, but hopefully we will get round to discuss that, because I think it's probably the biggest challenge of our time. Thank you again, and God bless you all.
Thank you, Prof, for the excellent moderation. Thank you very much, my friend.
It's a real pleasure, Hani, and I'll
Thank you,
hopefully
Prof.
keep in with you, and hopefully we can. You can teach me to pronounce your family name. God bless.
It will take time, but I will.
Thank you
Thank
very
you,
much.
Prof. Michael. Thank you to everyone. I really enjoyed this panel and I learned a lot from everyone. Thank you so much and looking forward to more insightful discussions. You've been amazing, Prof. Michael, as usual. We'll meet again, hopefully, inshallah.
I
Thank
hope we meet, and I can have some of that wonderful tea that you make over there. That's so flavoursome. God bless you. Without the dates, because I'm diabetic. Anyway, thank you.
Thank
Thank
you,
you so
everyone.
much.
Thank you, everyone from the
Thank you.
panel. We actually had Fahad leaving the panel all of a sudden because he had a meeting to attend to. But Mishal, Hani, Mubarak, Safa, thank you so much. And our dear panel moderator, Professor Michael, it definitely was an extremely interactive and insightful discussion. It is indeed great to hear about the experience and building strategies to manage care, delivery, and optimize digital health capabilities. Thanks once again and continue to have a lovely day.
Thank you.
We now have a short video from our platinum sponsor, Philips. Let's have a watch.
Health, the beating heart of your everyday. It's in every step of your journey, but no matter where your journey takes you, we are there with you. We collaborate with scientists, researchers, and hospitals to support doctors, surgeons, nurses, and caregivers across the world to give you the best possible solutions to improve your health. Innovation and you, Philips.
Well, Philips have called it out so well.